Welcome to the Champions of Active Women podcast. In this podcast, we will interview individuals who have been successful within athletics and beyond. We hope that these interviews will encourage and inspire girls and women to be active for a lifetime, to reach their goals, and to break new barriers in sport and life. This podcast is brought to you by the Active Women's Health Initiative and the Sports Medicine Research Institute at the University of Kentucky. The mission of the Active Women's Health Initiative is to optimize health and promote physical activity and wellness for girls and women across the lifespan. We hope you enjoy our conversations and join us in understanding women's health today to ensure women's health tomorrow. Dr. Scott Black is a board-certified family physician and holds a Certificate of Added Qualification in sports medicine. Dr. Black has a master's degree in exercise physiology and holds a certificate in sports nutrition. His primary interests involve disease prevention, wellness, and addressing the health and well-being of Kentuckians through the development of highly effective primary care clinicians. Currently, he serves as the Program Director for the University of Kentucky Physician Assistant Studies Program, Medical Director for the UK Sports Medicine Research Institute, and a member of the Active Women's Health Initiative Advisory Board. Dr. Black is an advocate for an active lifestyle and leads by example as an avid runner who has completed many races ranging from 5Ks to 100K ultramarathons. In his own words, he is passionate about women's health because, quote, "I'm the father of a daughter, the husband of a wife, and the son of a mother. Helping women thrive will help families thrive," end quote. Today, it's my pleasure to welcome Dr. Scott Black to our podcast via Zoom. So thank you so much for joining me today. I want to kick off the conversation by talking about your own active lifestyle and maybe just get started by talking about why leading a healthy and active lifestyle is so important to you.
Well, first, thanks for having me. And I guess I've been interested in physical activity about as long as I've lived. I was, active in organized sports when I was a kid and played a little bit of everything. And then as I got older, I started recognizing that I was becoming less physically active, particularly in college. That's when it really started. You go from all these organized sports, unless you're a varsity athlete in college, you kind of are left on your own. And so I was left on my own, and I picked up the freshman 15 and started feeling a little sluggish and decided to do something about that and started running and really enjoyed it, got interested in it, and quickly realized the benefits, and the rest is history. I've run ever since then.
Yeah,
and go ahead.
I was just saying, tell us a little bit about why you think running was the thing that kind of got you.
Right? It's easy. You don't have to have any special skill. You don't have to have any special equipment. You can throw on a pair of shorts and run out the door, and you don't have to go any place. You don't have to do anything. There's no obstacles. So running and walking, we're built to do that. People are built to walk and run. And so why not take advantage of that?
So what were some of your biggest challenges in kind of finding that active lifestyle again? Did you have to try out different things, or was it just you found running pretty quickly and went on from there?
I was fortunate. I found running pretty quickly, and I know it's not for everybody. And that's why if you want to look at it's probably the perfect physical activity is walking, because again, we're all built for that. And the majority of us can walk, and we all have a speed that we can walk. And if as we get older, it's that speed slows down, but that's okay too, because we're still working out when we're walking. So I think most people can find that they can walk effectively and get a lot of health benefit out of it.
And I know you practice what you preach, because not only are you an avid runner, but I see you often when I'm driving to work. I see you walking, I think, on campus or maybe into work. And so I know that you practice what you preach there too.
Walk to work every day and then run after that. So it gives you a chance to wake up in the morning and to kind of decompress on your way home in the afternoon. So I think if you have the opportunity to walk to work or park a little ways away from where you work and take a 15-minute walk into work and a 15-minute walk out of work at the end of the day, it goes a long way to doing a lot of good things.
Yeah. So tell us about the running you've done over your lifetime.
So it started out, well, like I said, in younger, as competitive, never really a stud athlete or anything, but just participated in competitive sports. But then I started just running on my own, and then started running some 5Ks and 10Ks, and actually turned out to be pretty decent at those things. And I got it as I got more interested in running, took it up to a half marathon, and decided to go ahead and run a marathon, and was really interested in those for several years, and at least from an age group standpoint, was competitive doing that. And then as I got older and started slowing down, I recognized that I was never going to get any faster, but I could run farther. And I got interested in ultra distance running, things past the marathon, and then discovered trail running. And I don't know why I didn't come to that earlier, but I only discovered trail running probably about 10 years ago, and really fell in love with that because you get all the benefit to being in nature. You get on the trails, which are a different surface than concrete. And it's just, it's a wonderful experience.
So, how much of your kind of interest in running is the competitive aspect? So you've maintained still doing races, and it seems like you keep pushing yourself to new goals. How much of it is that for you, and how much of it is just enjoying the running itself?
Well, that's changed dramatically over time. I used to be probably more competitive than I should have been, and it was really more competitive myself, trying to get faster and faster and faster. And then it became, okay, if I can't run faster, I'll run longer. And now it's just, I just enjoy being outside running. I like doing the longer runs, but not to see how far I can push myself more than I just enjoy being outside. And it's just fun. And, you can go play golf 18 holes. And if you're walking, it's going to take you about 4 hours, or I can cover, close to 25 miles in 4 hours running at a pretty easy pace. So, where do you get more exercise?
Mm-hmm.
And if
So,
you're doing trail running for 4 hours, I mean, you can see a lot of things in 4 hours.
yeah, kind of combining all the things you love
That's right.
into one activity. So you've run lots of races, so I won't make you cover even a small portion of those. But do you have a favorite moment, a most memorable moment, one that just sticks out in your mind that you'd like to share?
I have a couple for different reasons. I was fortunate enough to qualify for the Boston Marathon, and I ran that one year. And so, from a big race standpoint, that was probably the pinnacle of getting a chance to run Boston with 25,000 other people. And then the most memorable ones have probably been trail runs for different reasons. I had a spectacular fail on a trail run several years ago. It was a long run, one of the hardest I'd ever tried to do. And I went out too fast. I felt great. I was all pumped up for it. Adrenaline was flowing. And at about 45 miles into the race, I was going way too fast, and I ran out of fuel. And then the wheels flew off.
Yeah.
And I didn't make it to the finish, and I had a spectacular crash and burn. So that was memorable.
That is memorable. Not in the way I thought you might answer, but definitely memorable.
But I learned from it, and
Yeah.
I finished every race since then. You learn from your mistakes, and I knew what I did wrong from that point forward, and I've never had a problem since.
How do you think living this active lifestyle impacts other areas of your life? So work, family, relationships, any of the above?
I think it makes me more tolerable by my family. I think if I wasn't active every day, I'd be driving them nuts. So you burn off. Everybody has a little bit of stress during the day, and it helps you get rid of that. When it just becomes part of your daily activities, your daily habits, your daily lifestyle, you get used to it. I mean, it's just like brushing your teeth. And if you don't brush your teeth in the morning, you feel really funny by noon. Same way with physical activity. If you get used to that, as that's part of your daily lifestyle, if you don't do it, you don't feel good. And once you've gotten to that stage, I mean, it's easy to maintain it from that point forward, because it just becomes part of what you do every day. And that's how it is for me now.
So in your career as a clinician, medical doctor, you're focused on promoting health broadly among your patients. Could you talk about how you got to that medical career and, I guess just talk about how you got there first?
Yeah. I guess it's people. That's the same question we ask in the PA program to applicants. Well, how do you know you want to be a physician assistant? And the same thing I was asked when I applied for medical school. How do you know you want to be a physician? And I was, I guess, always really interested in medicine from the time I was a kid. I really enjoyed science. I was always fascinated by how things work. And there's nothing more fascinating than how the human body works. If you think about how complicated, how complex it is, and how it responds to different things. So I just really enjoyed science, and I really enjoyed people. You put those two things together, and it kind of leads you to medicine.
Mm-hmm.
And it's after practicing it now for 30 some years, it certainly has reinforced it. I made a good choice 30 plus years ago to pursue that.
So in your clinical practice, you've worked with athletes and non-athletes, and I'm wondering, when you think about those two groups of people, what do you see as some similarities in their health challenges and maybe some differences?
That's the kind of problems or the kind of medical issues they have tend to be way different. So let's just start with how they're different.
Okay.
And when I'm seeing people, and then when we're talking about athletes, it's whether we're talking about really competitive athletes or people that just wanting to be physically active. So if we're talking just about competitive athletes, their injuries either come from something that happened to them in an event. So football, a bad tackle, a hard fall, and you tear something. So an acute trauma, and you got to get that fixed, or a concussion, something that you're really dealing with in the moment. Or there's some kind of a training injury, an overuse injury, and been in the weight room and hurt their back, or they've, in example of cross-country runner, they're running 80 to 100 miles a week, and they develop a stress fracture or shin splints or whatever, and you got to deal with that. So the kind of things we see in that are more narrowly focused, because they're all directly related to not only physical activity, but high level physical activity, because they're working so hard. And that's just a unique set of problems. And then trying to get them back to the kind of physical activity they want to do is a different challenge than trying to get somebody that's just trying to be healthy back to doing some walking or something like that. I have people all the time that, another example from runners, if you look at really better sprinters and hurdlers, well, if they get a hamstring strain, they may be out, or they can't return to really normal activity for months and months and months. I get a hamstring strain, I can go back to doing some jogging in a couple of days. It's not going to stop me from doing what I need to do. But these folks are having to perform at 100% of their capacity, and they're having to go over hurdles at the same time. They have to be back really to normal before they can do those kind of things and perform at the level they're trying to reach. So it's just a different set of challenges to get them ready for that. Now, if you go to the average Joe trying to be physically active, what we know is that probably more than 2/3 of the people in the United States are not physically active enough to really have a benefit. So the first challenge is just to get them physically active. How do you overcome the obstacles that are keeping you from being physically active? How do I convince you that being physically active is every bit as important as taking your medicine on a regular basis? And it has as much effect on your overall health as remembering to take your blood pressure medicine. So trying to get that person to understand the importance, but then how do you not only understand the importance, but translate that to physically moving? And that's a different set of circumstances. The motivation for that person is way different than the competitive athlete. The competitive athlete is trying to win something. The non-competitive, just day-to-day physical activity person, I've got to show them some benefit from that. And that's not as easy to do, okay? Because they don't realize the benefit immediately. The benefits is earned and gained over weeks and months and years. And sometimes it's harder to see that. So that's another challenge.
Do you see any similarities in treating these groups as far as maintaining a physically active lifestyle?
Sometimes there is some similarity in that once you have somebody they understand they need to be active, and they're motivated to stay physically active. One thing we do know about physical activity is it does increase your risk of injury a little bit. And it depends on how hard you're going, how far you're going, those sorts of things. But compared to somebody that's sedentary, it may increase the likelihood that you're not going to develop shin splints if you're sitting all day.
It's true.
Now, if you start walking a regular walking program, you may or may not develop shin splints. You're more likely to than somebody that doesn't. So we have to take that into consideration. And so in that person that wants to continue walking and they're having leg pain, and the competitive athletes that's wanting to continue doing cross country, and he or she's having leg pain, it's really similar in that case. And I want to get both of them back to something they're interested in doing at the level they're interested in doing it. And I have to address their leg pain. Now, the difference is I've got to get the competitive person back to running 80 miles a week, and I have to get the non-competitive person back to walking 20 miles a week or something like that.
Mm-hmm. So when you think about, you mentioned injuries specifically. So when you think about just less the competitive athlete and more average individuals who are trying to maintain an active lifestyle, what are some of the challenges you see with, or advice you have maybe with getting people to prevent injuries and or come back from those injuries after they've had one?
I think people need to understand. So, with non-competitive sports injuries, you can kind of put them into two buckets. One is I did too much, too fast, too soon. Mm-hmm. Or on the other end, it's just that I'm doing too much. And I'll give you some examples of that. So I've decided I want to start a walking program. I've bought into the fact that, yep, exercise is good for you. Physical activity is really good. So I'm going to start walking. But if a little bit of walking is good, I'm going to do a lot. And not only walking, if walking is good, then running must be better. So I'm going to just jump into a running program. And, there's these couch to 5K and couch to marathon programs. I'm just going to jump into a marathon training program. Well, that's just a recipe for disaster, because what's going to happen? They're going to start running. They're going to get sore. Their feet are going to hurt. Their legs are going to hurt. Their hips are going to hurt. Their back's going to hurt. They're going to last about a week to 10 days and be so sore they can't keep doing it. They're going to be beaten up because of it, and they're going to probably quit. And then their impression is, this exercise, I don't want to do this. Too much work. It hurts. I'm sore. I feel worse now that I'm exercising. Where if they had started a walking program first, mm-hmm. and they just gradually worked into that and gave their body a chance to adapt to it. That's what we're trying to get anyways, adaptation. Give your body a chance to adapt. And then suddenly your muscles are stronger, your connective tissue is stronger, you're more used to the walking. And it does, when you first start, you might have soreness for a day or two, but then it goes away. And you just gradually start ramping things up. And instead of trying to go out, and my first goal is run a marathon, now my first goal is just to get to where I can walk for 45 minutes a day on a regular basis and feel good doing that. Mm-hmm. And that might take me 3 or 4 months to get there. And that's fine, because I've got to give my body a chance to adapt to that. So that's the one thing in introducing exercises. Don't try to bite off too much too soon, because it's a recipe for disaster. Same thing, you go in the weight room. What happens the first time you lift weights? You wake up the next morning, you can't wash your hair because your arms are so sore, you can't get them over your head. Well, you've done too much. You've got to just take little chunks at a time until you get yourself used to that. Once you get going, the same thing can happen though. I get really enthusiastic about something, and then I decide I want to go from a 5K to a marathon. And instead of going from a 5K to a 10K, from a 10K to a 10 miler, 10 miles to a half marathon to a full marathon, I go straight from a 5K to a marathon. And what happens? I develop an overuse injury as I'm doing that. And I end up taking 6 weeks off. And I feel like I'm better. So I jump right back into training instead of gradually resuming training. There's this whole return to play or return to training progression that we should go through, that most people try to skip past that, and they go straight to go and collect their $200 and move on. It doesn't work that way. You got to be patient with these things. So I guess if I can preach one thing, is patience with physical activity. Give your body a chance to respond and adapt to what you're asking it to do.
I think that's a great summary, and it kind of goes in line with more of a lifestyle approach to physical activity. So thinking about the end game here is not the next thing; it's a lifetime of activity, and it seems to fit well with what you're saying.
Absolutely, that's a great way to look at it.
So, what have you found most rewarding in your clinical career?
Oh, that's a great question. Most rewarding would be when you see. So again, there's, I guess, a couple different ways to think about that. As a physician, when I have been able to convince somebody to take control of their personal health and well-being, my job is done. If I have somebody that can they understand why they have type 2 diabetes, why they have hypertension, why what they're doing is directly related to their risk of developing cancer, and then how they can manage that, or even something like musculoskeletal pain. Somebody, I see people, tend to get referred folks that have been to primary care and that with their back pain, and their back pain hasn't gotten better in 2 or 3 months, and they've had a thorough workup, and why am I still having back pain? Well, at that point, my job becomes teaching them why they're having pain and how they can self-manage that. And it's no difference if chronic back pain is the same as having chronic hypertension. If you think about it that way, there are reasons for those things. They don't just happen. There's a reason behind that. And when I see that I've been able to teach somebody that, and that they recognize that, and now they understand how they can directly influence that, and physical activity is a big part of that, but how they can make it better on their own, then that's the most favorite thing I have in medicine. Is when I see that happen. It's like, I guess it's like being a teacher in a classroom and your students get it. Then it's really rewarding when you see that you're able to make a difference. And it's the same thing in medicine. When people can recognize that and they can self-manage, at that point, your job is done. You just kind of serve as a coach. You just kind of guide them along a little bit and helping them get to that goal. And that's very rewarding.
Well, and I think it's a really great perspective on the role of medicine there, and thinking about not only medical interventions, but thinking about physical activity and other health behaviors as medical interventions.
And
So,
that's one
go
of
ahead.
the shortcomings. I think of medical education. If we think of, we try to get, we have so much information that we try to get into students' heads in a short period of time. And you think about all the physiology and all the pathophysiology and all the medications and all the diagnostic tests, and you go through all these diseases and how they present and what's going on when someone has those and how you treat those. And you have all these, you generally have either medicine or surgery, and you have some kind of a diagnostic study to think about. Sometimes I think we've shortchanged the basics and how influential things like physical activity, good nutrition, and management of psychological and stress, and then social determinants of health, how influential those 4 things are in somebody's health and well-being, and how much of an impact they have on their hypertension, on their diabetes, on their coronary artery disease, on their heart failure, on their chronic lung disease. All things have happened for a reason, and they don't just happen. They don't just come out of the blue. There's something that produced that, and I don't think we spend enough time in medical education helping medical providers develop the skills necessary to get behavior change in our patients. And that's a real difference we could make.
So, as part of our Active Women's Health Initiative, we are really interested in promoting active lifestyles, in particular for girls and women. And we're happy to have you as an advisory board member. And I'm wondering if you could just tell us a little bit about why you think the health of women is so important.
It's it's half our population, half are men, half are women. So it's the health of half our population is at stake. Women tend to live longer than men. Okay, so if they're going to live longer, they may be more prone to developing some of the what we consider diseases. I'll use that term loosely, diseases of advanced age, like frailty. And women, because they live longer, they are going to live on they have a greater chance of living on their own, and not having a spouse or someone else to help them as they get older. So, maintaining their functional independence becomes really important. Also, women, I think, for the most part, tend to be the caregivers in families. I mean, those are if you think about growing up as a kid, if you fell and skinned your knee, who'd you go see with that? Your dad or your mom? And I'd say 9 times out of 10, and you ran to your mom with that because your knee was skinned up and she was going to take care of it. So women's role in the healthcare system is vital, and the family system is vital as far as delivering health and well-being information to the people in the family, but then also just the personal care and well-being of women as they get older is important. And then I guess the last thing I would say about that is that in my experience, women often will ignore their own health and well-being because they're the caregiver for somebody else, and they always prioritize somebody over them. And having them slow down and take a serious look at their own personal well-being is important. So I think it's all those reasons make it important.
As you work with both male and female patients to help them try to maintain their health over time, and particularly thinking about health behaviors, do you find that there are different approaches that you use with women, or different motivations that you see? Any kind of differences you see between men and women?
I think, and these are broad stroke generalizations,
Right.
but I do think women are more. I think in general, women take health more seriously than men. That's just been my experience, and I think there's lots of reasons for that. But I think women recognize the importance of health a little bit better than men do, and so I think they're more responsive to conversations about health, and because of that, I think they're more open and receptive to conversations about lifestyle change, personal habits, and how those directly influence their health and well-being. That's just been my experience, and sometimes they're an easier audience to reach than men.
So, not only are you an active role model for your patients and your students, but I know that you're likely a role model for your own daughter. And I was wondering if you could talk about family physical activity, and if you all are active as a family, and kind of what that is like for you.
Oh yeah, we are active as a family. I mean, we all kind of have our separate things we like to do. Again, I'm more kind of organized, and this is a physical activity, and this is I'm going to go run, or I'm going to go. I cycle too, and so that's something else I might do, or go to the gym and lift weights. But it's almost it's almost a prescription for me. This is what I do on a regular basis. Wife is much more physical activity is just part of what she does over the course of the day. She doesn't do like organized physical activity. She likes to garden. She likes to be outside looking at birds or butterflies, whatever it is. So it's a different kind of physical activity, but it's still physical activity nonetheless. And I think my daughter's probably somewhere in between. And she grew up playing sports. She's a softball player as well. And then as same thing, got to college, and physical activity level started dropping. And I think she recognized that she felt better as she was more active. And so she does a little bit more running and that kind of thing, more like her dad.
Mm-hmm. So what do you hope that she learns from you about being active and healthy?
Well, I hope she doesn't make the mistakes I made early, and think about it more in a sense of kind of real specific goal oriented, and finish a marathon or run a certain time in a marathon, because that just increases it makes it work, and it increases your likelihood of getting injury. And I hope she really looks at the later example now, that I just enjoy it, like getting outside and doing things. And if she can adopt that, then I think she'll do well.
Yeah, when we find something we enjoy, it gets a whole lot easier
That's
to
right.
be active. So what advice would you give to women or girls about playing sports and in general leading an active lifestyle?
So, organized competitive sports are just that. They're competitive, and we do keep score for a reason. People want to win. Um, and so I know that's important. And it's when you introduce that kind of competitive edge to things, there's definitely a positive side of that, but there's a negative. And we have to keep all those things in perspective. And you know, one of the things is learning to win and learning to lose. And when I say learning to lose, I mean it's not to see the loss as a failure, but as an opportunity for improvement. And that's what you got to. You can't internalize that as that. From a physical activity standpoint, a loss leads to be saying, "Well, I'm just no good at this." It's that, okay, let's analyze this, and let's don't look at this as a failure as much as we're not all good at the same things, and I obviously didn't do as well in this. So what can I do to make this better? And when you look at competitive sports like that, you kind of enjoy the wins, you learn from the losses, and you get better from that. And at the end of the day, I think we recognize that sports is a lot about adopting a physically active lifestyle. It's a lot about team building. It's a lot about learning what you're good at doing and learning how to learn from your shortcomings and your losses. And if you've done those things, then competitive sports are great. I think it's when there's an uglier side of things we just have to learn to avoid.
And I think you gave us a great example earlier of, totally bonking on a trail run that you fully had intended to finish and getting back up and not letting that slow you down.
Yeah, I was, for a good several weeks after that, I was mad. I really wanted to finish that run. I felt bad. I was kind of hard on myself. But then I said, you know what? You got to learn from that. And what did you do wrong? And it was clear. I went out way too hard. I didn't take enough fuel, and I ran out of gas, and I couldn't catch back up. So yeah, it was a failure. But it was just because I made a bad choice. It wasn't anything wrong with me. I messed up. But I learned from it, and it hasn't happened since.
Mm-hmm. I'm listening also as a mother of a young child, a boy, but a young child who's playing sports, who I know is kind of leans more towards that uber competitive and, sees loss as a failure and really working hard. So I'm listening and taking in these messages as a mom, as well as a regular audience member as well. And I think those are good messages about using sports to teach failure and learning from failure.
Yeah, I guess the real competitive people would disagree, but I would say there's nothing wrong with losing if you gave it your all and you learn from the loss. I mean, it's a learning opportunity, and it's an opportunity to grow and to get better. And no matter how good you are at something, there's probably somebody out there better than you at that particular thing. Well, if you're going to try to compete with that person, you have to figure out. It's a great challenge. How do I compete with this person? Either physically, they have more talent, or maybe they're farther along in the development process than I am, and what can I do to level the playing field? And that's, look at it that way, and it's a great challenge, and it's fun.
Yeah. And I think, whether you're the athlete or whether you're a parent of an athlete or a coach, I think, kind of keeping that long-term game in mind, right, is a helpful perspective that you gave us earlier. Patience is a good thing, and regardless of where you are in that process.
Mm-hmm. And just understanding that it is a process that's never over.
Mm-hmm. So is there anything else you'd like to share with our audience today?
Well, again, I would encourage everybody to understand the impact that they have, each person has, on his or her own health and well-being. And that's not meant to blame people if they're not in good health, but more to encourage them to realize that they do have a lot of impact on how things turn out. And they shouldn't feel blamed. We'll use diabetes. If you have type 2 diabetes, you shouldn't accept blame for that. But at the same time, you should understand that you have a lot to do, that you can do to make that better. And it's just like learning from your losses. Where did things go wrong here? And what can I do to fix that or to make things better.
Mm-hmm. An empowering position, right? So that you can do something to improve your health.
That's right. That's the word I was looking for, and I couldn't come up with, is empowering someone to understand that they do have they do have influence over their own health and well-being. It's not something just taken out of your hands.
Mm-hmm. Well, we thank you so much for your time today and sharing some of your personal and professional experience with us, and for being an active board member as well.
I've enjoyed it. Thanks for having me.
Thank you for listening to the Champions of Active Women podcast. This podcast is brought to you by the Active Women's Health Initiative and was produced by the Faculty Media Depot at the University of Kentucky. If you enjoyed this episode, you can listen and subscribe to all of our episodes wherever you find your podcasts. For up-to-date information about the Active Women's Health Initiative, you can find us on social media at UKAWHI. Thank you for supporting us as we work to promote health and physical activity among girls and women across the lifespan.